share it with you too. All right. Okay, so this is chapter 9 from your massage therapy textbook. Contraindications, when essentially not to massage, or when to take precautions, or all that kind of stuff. So let's talk about this. Again, feel free to ask questions, to interrupt, whatever. So this is going to sound like an oversimplification, but probably the most important thing you can do as a massage therapist is to wash your hands before and after every client. We actually work in an extremely safe field, I'm glad to say, and all the research shows this too. Extremely safe field when it comes to infections and such, because we don't break the skin. If you're an esthetician, or even a hairstylist actually, you're dealing with implements that can actually break the skin. We don't ever break the skin, and skin is a really effective barrier against infection. So getting something on your hands is not terribly dangerous. Not getting it off your hands later is, because it usually winds up in your eyes or your mouth, or on somebody else's eyes and mouths. So what we really want to be doing is, these are the things that I'm touching all my clients with. And the minute I'm done with the client, I want to be washing these hands of mine, and before I start the next client, I want to be washing my hands of mine, because that's really our biggest thing. Obviously, you want clean sheets, and we'll talk about that, and you want to wash off your lotion bottle, because that's how you can move infection through an object to another person. But hand washing is a lifesaver, we take it for granted in this country. I don't mean we don't do it, but we take it for granted. In other countries where they introduce hand washing with soap, like, infection falls in half overnight. Just washing your hands makes a huge, huge difference. And I'm making such a big deal out of this because my favorite thing about our profession is that none of my clients have ever left my room worse than they came in. Now, I will admit some probably left almost the same. I'm sure there are days I didn't quite get it right, but nobody left worse. And it's very neat to be in a healing profession where nobody leaves worse. And if you wash your hands, you can almost guarantee, and you do the other stuff we're going to teach you here, but you can almost guarantee nobody will ever leave worse, and that makes me feel very good. If you're a surgeon, you do amazing things, but some people leave way worse than they came in, right? And so washing your hands, washing your sheets, washing your lotion bottle turns this into an extremely safe occupation, along with one other thing which I talked about last week, which is going slow. Remember, any move done fast can be a dangerous move. Any move done really, really, really slowly is not dangerous. I don't care what you're doing. So, slow and soap. They are our friends. Yay. Cool. So, these are just some definitions to know, because they're going to be out throughout the book. We're going to use them in other areas of the book. Disease is any abnormal functioning of the body. And I want you guys to think about what it really means. It means lack of ease, dis-ease. And a lot of our clients are going to be coming to us literally because they lack ease of movement. They lack ease of function. They are in a disease state in that sense, and we are trying to get them back to normal body functioning. That's really what we're trying to do. Pathology is the study of disease. And when we do systems of the body, when we study each system of the body, we'll also talk about common pathologies associated with that system of the body. So we will talk about common diseases related to that system of the body. So if we are doing the integumentary system, which is essentially your skin, we'll get more into this, but it's essentially your skin, we will also be doing pathologies of the integumentary system, meaning common diseases that you might come across as a massage therapist on people's skin. Because it's important to kind of be able to recognize some of that stuff. Never are you diagnosing, but it's very helpful to know what you can and can't work on, and that's why pathologies become important to us. Syndromes, this is kind of an interesting point here. Syndromes are a group of symptoms that people gave a label to, really. So sometimes you'll hear about TMJ syndrome, which stands for temporal mandibular joint syndrome, which means jaw joint syndrome. And the reason they call it a syndrome and not a disease is because there's a group of symptoms around this issue that they're able to easily label, and they see repeating themselves in other people that have problems, and so they call it a syndrome, but they don't call it a disease because they don't always know what's wrong. So in syndromes, you're often saying, yes, there's something wrong here, it's a common thing, we've given a name to it, but we actually don't know what causes it. And TMJ is a really good example of that. Temporal mandibular joint syndrome is something that they still don't quite know the cause of. They know a lot of the symptoms of, but they don't know the cause of. And why is this important to massage therapists? Because we seem to work on a lot of syndromes. Because these are things that there often aren't really easy cures for. And when it comes to like TMJ, for example, massage is actually very effective. Very effective. And I don't say that about everything about massage. It's not like massage cures everything. But with TMJ syndrome, it's actually very effective, and there aren't really anything else that is effective. They found that surgery is not effective, and most surgeons even don't recommend it. And so you're left with very few things, and drugs don't really help, and so massage is one of these things that helps the syndrome. Yes, Mr. Craven, please.
I watched this like weird. It was like a Russian face massage. Is that kind of like, what's that kind of for, or like treatment for that?
I have no idea because I don't know what Russian face massage is.
It was wild. Like it was. I mean, it was a lot of face stuff, but they actually go into your mouth, and they're just like going at like your gums and loose.
In temporal mandibular joint syndrome treatment in massage, you can go inside somebody's mouth. When you're doing it in TMJ, so maybe they are similar, I don't know. But maybe they are similar, but you can go inside somebody's mouth, obviously with their permission. And you're going in there to push on what's called their medial pterygoid. It's a muscle that attaches to their jaw joint, which can cause problems in TMJ. So I could definitely see the similarities, you know what I mean?
Cool.
Yeah, but I've just never heard of, I've heard of Russian medical massage, but I've never heard of Russian, now I've got to go Google it. Yeah, I'll check it out. Thank you. Did somebody else have their hand raised? I thought they did, and then I lost it. Maybe? Maybe not?
I did, but then I put it down.
Okay, you sure? You want to put it back up?
No, it's fine. I was just going to say, like, because I have the TMJ, and I was just going to say the only thing that helped me so far is they flushed out my joint.
Oh, they did?
Yeah. And that lasted about like 2-3 years of no pain, no clicking, no locking, and all that. But now it's just like kind of coming back, so I have to go back and do it again.
Yeah. And they're flushing out because you're getting a little bit of debris in the joint, I take it?
Yeah, something. I don't know. Yeah.
Yeah, I mean, we do know that with TMJ, the problem is there gets to be this irritation in the jaw joint itself, and I could see that rubbing could leave little bits of cartilage and things like that, and flushing that out might help. That's interesting. Very cool. Thank you for sharing. Yeah. Diagnosis is not something that you will hear us talk about very often because it's the process of identifying disease, and it is against your license. Be careful. Don't tell people you have this condition because we're not licensed to actually diagnose. Now, that doesn't mean I can't say, hey, based on what you've told me, I'm going to run on the assumption that these things could be present and I'm going to work on them. Like you might have these various conditions, but I can't tell you if you do or not. I'm not qualified to. The cool thing in massage is that if I'm wrong about what I think it is, massaging it probably won't make it worse, right? So the kind of nice thing about massage, when somebody comes into me with issues, I'm sitting there thinking, what are all the things this could be? And then I tend to work on all of those if I have time. So it's okay to kind of guesstimate. Just remember, it's not your place. You can guess anything you want, but be very clear that you are not telling the client they have a certain condition because we're not allowed to. And it gets you into some legal hot water, hot water if you do that. Yes, Ms. Carrillo, please.
Can you give like an example?
Yeah.
Just like how the conversation would go, so
Sure.
I can understand it better.
Let me give you a really good example because it comes up all the time. And it ties into something else that's good for you guys to know. So you are going to do I put this? Oh, well, I'll put it the way it's true. Just think about this for a second. You are going to touch people more thoroughly, and let me explain what that means in a second. You guys are going to touch people more thoroughly than probably their own spouse does, right? Your own partner doesn't rub down your entire leg and get to every single toe and check every part of your back, right? They might hug you and kiss you and whatever, but you're actually going to be inspecting people's bodies with your hands more thoroughly than a doctor would. And you're going to come across all sorts of stuff. And when I find bumps on people's bodies, I always tell them, because if unless it's like on their forehead and I know they know it's there, but usually it's on their back, right? They don't know it's there. I don't know that their spouse has ever noticed it's there. I don't know if they have a spouse, right? And so I'm always like, just to let you know you've got a bump in this area here, right? And I do that as a courtesy because that way they know it's there. I'd feel terrible if they had some treatable cancer and nobody ever told them that they found a bump there. Anyway, the minute I do that, they always go, well, what is it? And I go, well, I don't know, actually. I'm not qualified. Well, do you think it's cancer? And I'm like, I don't want to make you nervous at all. I have absolutely no idea, but it's worth getting checked out. They're asking me to diagnose at that point. And so that comes up a lot where people ask you to diagnose. They don't realize they're doing that, but I can't, for one thing, I don't know. And secondly, I'm not qualified to diagnose. That would get me into real hot water if I said it was cancerous or not cancerous and it ended up being, the other way around. So that comes up a lot. But that's the big one. That's the big one I can think of. But it comes up in other situations where maybe somebody has a shoulder problem and I go, well, maybe these muscles are tight and whatever. And they'll be like, well, I might have a torn whatever. And I'll be like, well, I can't diagnose that. I'm not qualified to do that. So I think those are pretty good examples. Does that make sense? Okay. Yeah. You guys will notice almost right away that people start talking to you like you're a doctor in this class. They're like, and they do it to me at work to this day. They're like, I know you're not a doctor, but can you give me your opinion on blah, blah, blah? And I'm like, I don't know. I'm just a guy. I just rub backs. So it's not that we don't know anything, but to compare an 8-month program of massage therapy to a 12-year doctor's training program, I think is arrogant. So anyway, but it will happen to all of you. People will start asking for medical advice now. So just something to be aware of. Ms. Carrillo, I saw you raise your hand again. Did you have another question, or is that?
I was just gonna summarize. So basically, the proper professional response would be, I don't know, you could get it checked out, or that was mainly just the main thing that I got.
Yeah.
We just can't say it could be this, or this. We just have to say, I don't know.
Yeah, and you gotta tell them, I don't know and I'm not qualified to tell you, and I wouldn't want to tell you wrong. Tell them the truth. I love telling people that too, and you'll see me do it as a teacher with you guys. When I don't know, I'm like Russian facial massage. I don't know. Because I want you to believe me when I say I do know. So I need to admit my ignorance when I don't. And I want my clients to believe me too. So honesty goes a long way in those types of situations. But yeah, they're always going to ask for that kind of feedback from you. Well said. I also like what you did there, Ms. Carrillo, which is she mirrored back what I said to make sure she understood it. That's not only a good thing to do in class, that's a really good thing to do with your clients. So you're telling me that your foot hurts and you do want it worked, but I need to be very careful. No, that's not what I was telling you. I was telling you don't work it at all. Those kind of things are really good to kind of read back to people to make sure you really understand them. They love it. All right. Prognosis is trying to look into the future, by the way. It's trying to decide what's going to happen with a disease in the future. Like you have a common cold, and my prognosis is in a week you'll be fine. So that's what prognosis is. Signs and symptoms. This is kind of an important difference. Signs are usually what you guys notice. Symptoms are usually what your client tells you. So your client says, I've got a headache. We don't actually know that. They're telling us that. And that is a symptom they are sharing with us. That is their subjective evidence. That means we have to trust them. It's coming from the subject. This will matter later when we do SOAP notes, which are medical notes on your clients and such. But subjective evidence is coming from the client. It's their opinion of how they feel and what's going on. And we do trust that information, but we know it's their opinion. Signs are objective evidence, and they tend to be stuff we've witnessed. We're witnessing about the object. So they might tell me subjectively that they have the symptom of a headache. I might objectively notice that their head is leaning way over and that maybe that tension there, that's just something I subjectively noticed, but then I might conclude, like, I wonder if them leaning over so far is putting a lot of neck strain on them, which is causing the headache. That's a little bit of an oversimplification, but honestly, if somebody did come to me and said they had a headache and they were kind of leaned over their head forward a lot, I'd be like, that could be part of the problem. It'd be one of the things I work on right away, I'll tell you that. It's just their head positioning. Yes, Miss Eversole, please.
Sorry, question for you. So you're talking about subnotes. Do you guys do charting?
Yeah, we don't do charting, but we will go over it with you guys. I've got real mixed feelings about charting. I don't mean real mixed like it's a good idea in general. The reason I have mixed feelings about teaching it is every place does it differently.
Okay.
And most places have gone to electronic charting programs, which are delightful because they keep all those records there and all that kind of stuff. And it's very quick to teach you charting on it's very quick for them to teach you charting on their particular system. But we will go over the concept of charting and intake questions and all that kind of stuff because the concept is really important. Like, what symptoms do you have? What do I notice? You know, that kind of analytical approach to your massage is extremely important. So,
yeah, okay.
But we were not going to have you fill out a strict SOAP note form and blah, 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 blah. Yeah.
Okay, yeah, that's just in my line of work, so I was just wondering if we were going to do some charting or not.
Yeah. I mean, you will do some practice in class, but it's not going to be an extensive part, no.
Okay, cool. Yeah, I'm very familiar with it, so I figured I'd ask.
Very cool. Yeah. Charting, note keeping in your clients is also helpful, by the way, when you have regular clients, for remembering other things about them, like birthdays. Things that are kind of important to know. Did somebody else have their hand raised? Yes. Miss Carrillo?
I'm so sorry.
Don't be sorry. Every teacher wants an engaged student, trust me. You can ask questions the whole time.
I had a question of, I don't know what charting is, so I was wondering, but then you said we would discuss the concept and everything later. So
but really quickly, just so everybody knows, there's something called SOAP notes. Now, there's all these variations of SOAP notes, so don't get too caught up in that exact term. But SOAP notes stands for Subjective, Objective, Action, and Plan. And they are medical charting that's used in the medical field all over the place, but massage therapists adopted it too. And essentially the first section is subjective, and it's what did my client tell me? My client came in and they told me their knee hurts and their elbow hurts, and they've got a little bit of shooting pain down their right leg. That's subjective. Boom. The next section of the chart, so you'd write that down in the little chart. And sometimes they use abbreviations and all sorts of stuff, but the fact is that's what that does. And by the way, a lot of places are moving away from abbreviations, and you literally just write in there what they told you. The second section is the O of SOAP, and it's objective. And that's what you witnessed. Like, I witnessed client coming in, left shoulder was elevated, right shoulder was down, you know, lateral deviation of the jaw, who knows, whatever you notice. And you write that down in the objective area. Action is the next thing, and you write down what you did that time to them. I stretched the client using PNF stretching and stretching their hamstrings, and I tried to open up the shoulder by doing such and such, and I did deep tissue techniques on their back, and I worked the temporal mandibular joint on this side because I think it might help with the deviation to that side. And then plan is kind of what you're going to do in the go forward, what homework you gave the client, all this stuff. Like, I told the client to go home and continue stretches, and I'm going to repeat this next time if we see any results or whatever. So it's subjective, objective, action, and plan, essentially. And the good thing about them is that, well, a couple of good things. One is if that client comes in again and you're not there and you work for a big place, somebody else can pull those notes out and know what to work on. But the other thing that they're good at is seeing if you're made progress or not. So quite often when you come to me with a problem, I have a plan of attack. But if my soap notes show that I've done that 3 times in a row and I'm not seeing any difference in you, then I'm probably wrong about what I thought it was and I need to change my plan of attack. So they're also a nice way of recording, like, here's what we're doing, and the client's not reporting that it's getting any better, and I keep doing it, so maybe it's time to try something new. So that's the concept of soap notes. And you'll hear, by the way, thousands of other acronyms, not thousands, but 25 other acronyms, but they're all soap notes. They really are. It's just different variations on how to do them. Okay. So, acute disease and chronic disease. Acute disease is not a durable disease. It is something that comes on very quickly and persists a short period of time. And believe it or not, I mean, in some ways, breaking your arm can be an acute disease. You know, it comes on very quickly, and relatively speaking, they actually heal very quickly. You actually will not work on a lot of acute diseases, because when somebody injures themselves in an abrupt manner, they're probably not going to come for massage. You're actually going to end up working on an awful lot of chronic disease, like somebody with chronic low back pain. That'll be half your clients right there. Chronic temporal mandibular joint syndrome. That'll be 10% of your clients right there. Chronic, plantar fasciitis, which is inflammation of the bottom of their foot, essentially. That could be 10% of your clients right there. So these are chronic, long-term things that don't seem to go away, and they last for a very long period of time, and quite often it's very hard to figure out how to get rid of them. Those things we tend to work on more chronic lifestyle overuse type injuries in massage. So you tend to work on a lot of runners that come in and say, I'm having feet problems and I don't know what the problem is. And I go, well, how often are you running? Well, 7 days a week, but once my feet started hurting, I cut way back to 6 days a week. And I'm like, okay. So I admire the athleticism, but that's an overuse injury. I mean, no shoe or whatever, even massage is going to fix that. It will help. So anyway, that's kind of a chronic condition, right? It's an overuse thing. A lot of people are going to come to you are going to work at desk jobs, and they have chronic problems with neck and back and shoulders and headaches and things like that, probably from just the lifestyle of sitting at that desk. Okay, so there is such a thing as local disease and systemic disease. And this is very important to a massage therapist. So a local disease could be a skin rash that you have just on your left forearm. Maybe you got some kind of irritant on it, maybe something scraped it there. It doesn't spread to your whole body. It's just on your left forearm, and that is local, as in close, local. It's localized, it's not spreading. And then there are systemic diseases that are throughout the whole body. And the reason that I'm making this distinction with you is it ties into contraindications when we get to them. Because there are basically 2 types of contraindications. One is what we call a local contraindication, which is don't rub that area. And the other one is what we call an absolute contraindication, which is usually from something systemic throughout the whole body where we say don't rub them at all. So if I burn my left hand on the stove, you should not massage it, okay? But that's a local contraindication. If I seem fine and I'm not running a fever or whatever, it depends how bad a burn it was, but basically you can rub the rest of my body. I have a local disease, a local contraindication. If I come in and I'm running a high fever, that is a systemic disease, and that is an absolute contraindication. You shouldn't massage me at all. I'm already compromised throughout my entire system. So that's the big, big difference. Local and general or absolute, which means just one area or don't touch the body at all, right? In many ways, you're going to come across many, many local contraindications. Somebody's be like, oh, I cut my thumb with a little knife. Of course you're not going to rub their thumb. You know, that kind of stuff. I've got a, you know, I don't know. I've got a scab here from where I fell down. We wouldn't rub that either. Yeah. Miss Carrillo, please.
Sorry, I'm sure everyone's tired of me.
No, not at all.
Example, the local area, like I just got my vaccine shot, so my arm is tender. So that would be the local area, and you would just avoid that area.
Yes.
Whereas if I was like sick with a cold, then that's absolute. That's the systemic disease,
Yes.
right?
Yes.
Okay.
It affects the entire system. That's what that means. And yeah, to use your vaccine example, you got the vaccine shot. Your arm's really sore. I avoid that area. You got, that's local. You got the vaccine shot and you spiked a high fever because you're reacting really harshly to it. That's systemic. And I'm not going to do a massage at all. So that same thing turned into a bigger problem, right? Just temporary, but bigger problem. Yes, exactly. We will deal, by the way, with lots of idiopathic stuff in this class, and idiopathic means diseases without a known cause. So we will deal with lots of disorders without a known cause, but they're called idiopathic. You won't hear a lot of massage therapists use this term, by the way. But they do understand the concept because we deal with lots of stuff that does not have a known cause, which is why they're coming to you for massage. Like lots of back problems where they're like, we're actually not quite sure what's wrong with this person's back. But it's not worth doing surgery on, and it seems to respond well to massage, and while massage doesn't cure it, it makes it enough better that the person has a fairly normal life. So that's an idiopathic condition where we really don't know what causes it. That doesn't mean we don't know how to treat it. And quite often massage is part of that. All right. And risk factors for massage therapists are not washing your hands for you catching disease, not only giving it to your other clients. Yes, Mr. Snell.
What if the client has acne on the back?
You can work on them, but you wouldn't work on anything open. So
Okay.
if they have, I'm sorry to be graphic, but if they have oozing pores, you would not rub those. And they probably don't want you to rub them either way because they probably don't want oil and all that kind of stuff all over there. But if everything's closed up, it depends on how severe the acne is. You can rub basically anything. It's just most clients aren't going to want you to rub their acne. Are you talking about like when you get like somebody's back and there's acne all over it kind of thing?
Yeah.
Yeah, that one's tricky. So I've had clients where the back acne is really, really bad, and what I do is actually rub them through the sheet. And I'm very careful to make sure that they don't feel like I'm grossed out. It's not that. It's that I don't want to rupture their acne, and I don't want to rub oil all over it and all that kind of stuff. So if it's pretty severe, I actually cover them up with a sheet and do these kind of big fascial movements that you guys will learn about, very specifically you'll learn about. In lab, actually, not for a couple months, but you will learn about them in detail so that you can do massage through the clothing and such. Yeah.
Okay, thank you.
You're right. You don't want to rupture anything. You should know some of these terms already because we are in the midst of an epidemic where a large number of people are infected or could be infected with a disease. And epidemiology is the study of transmission of disease, which you're probably very familiar with now too as well. I'm not going over the rest of this because we're not going to use it much in this class. Pandemic, right? Let me tell you the difference between morbidity and mortality. So morbidity is the number of people affected by a disease. Mortality is the number of people that get killed by that disease, right? High morbidity is not usually the end of the world. It's a high mortality rate coming from that morbidity, right? So we don't care. I'm sorry to use this example, but it's very relevant. It's not just that we care about how many people are infected with COVID. We care about how many people die from COVID. You know, is it 1% of people infected, 2%, things like that? And the people that die from it is the mortality rate. If 2% of people who get COVID die from it, it has a 2% mortality rate. And morbidity is the number of people who actually get it in the first place. Yes, Ms. Hendrickson, please.
So when you're saying affected, that means like they have symptoms at all?
Yes.
Okay.
Yes, I'm sorry. Yes. Not affected like we're thinking like, well, I was affected, I had to wear a mask for a year and a half and I had to quit my job. Yes.
Well, I meant like if it's severe or not, or if they even just have any symptoms.
Yes. In fact, theoretically it means if they have it at all with no symptoms, but we probably don't know about those people, right?
Oh.
So theoretically the morbidity rate is often higher than we actually know. In theory, I mean, it's a pretty easy to support theory. More people have caught COVID than we've recorded because we don't catch everybody. And some people are able to be carriers of it and not really show much symptoms, or they knew they had it, but they're like, why report it? I'm going to stay home sick. Like, that's it. So we suspect the morbidity rate is higher, but you're absolutely right. In fact, they got the disease. Whether they got symptoms or not, they got the disease. It's in their blood. Good question. Yeah. So you will hear something called R naught sometimes. R0, R naught. It's really referring to how contagious a disease is. It's something we really, really care about. I might have an example. Yeah. So the R naught for COVID, the last time I checked, is about 5.7. So what that means, it's very simple to read what R naught means. It means that roughly for every person infected by COVID, they infect another 5 to 6 people. Right? So when you get an R naught of 1, that's fantastic because it means every one person that gets this usually infects one other person. And so it's very hard for a disease to grow. You get an R naught of 2, for every one person that's infected, on average, another 2 people catch it from them. That's when diseases start to grow. When you get up to 6, you have some problems because every one person that gets infected tends to infect another 6 people. And just to give you an example, the R naught for flu is just a little bit over 1 person. So COVID-19, according to the scientists, is much more infectious. And this is not the Delta variant, which is even supposed to be more infectious than this, much more infectious than the flu. So R naught, you will see it in papers sometimes. So when you see R naughts that get above 1, it's a little bit of concern. When you get them up to 6, 7, 8, 9, super infectious. But that's what R naught is. It's a number assigned to how many people you think on average, by the way. That means, by the way, one person's not infecting anybody else, another person's infecting 12 other people. But you get an average of how infectious a disease is and how many people it's getting passed on to and all that stuff. That's called R naught. Boom. And here's the mortality rate. Mortality rate of COVID is very hard to nail down, but it's between 0.6 and 6%, which means 1 to 6 people out of 100 who get COVID can die from it. It's at least to that 1 percentile, which is not great odds. And just to clear up something too, by the way, I'm not trying to push a political agenda if any of you are like, that's baloney. Just trying to explain the science as it pertains to our class. But the other thing that can be a little bit deceptive is people say, well, they didn't die from COVID, they died from diabetes, and they happen to have COVID. Well, that's a little bit of a misnomer. They were living with diabetes before they caught COVID and then died. So you can argue they died of diabetes, and it's true, but they wouldn't have died of diabetes if they didn't get COVID. And this is just like AIDS, by the way. You don't die of AIDS. AIDS doesn't kill you, right? But you die from all the stuff you get after AIDS destroys your immune system. And so saying, oh no, he died from the flu is a big lie. He died from AIDS. He would still be alive. The flu wouldn't have been a big deal. So be very careful when people are like, oh no, COVID doesn't kill. Yeah, it doesn't kill all by itself, but it kills people that would have been living already. Just like AIDS kills people who would have been living just fine, that flu wouldn't have been a big problem. So it's a little bit deceptive. And we can see that the mortality rate of flu is way less, by the way. It's 1 out of 1,000 people. That too is a comorbidity kind of thing where those people usually had some other problem with them too. And they wouldn't have died if they didn't get the flu, but they did get the flu and then that was too much. So that's why, by the way, that's why scientists are very worried about COVID. They've got something that they feel like is probably 6 times more contagious and about 6 times deadlier. So that, put all that together, that's 36 times worse kind of thing than flu. So from their point of view, it's much worse. And we know they're probably right, by the way, just from scientific evidence, because we've had more people die this past year in the world than we should have. Dramatic increase. Okay. We will deal with a lot of the modifiable risk factors with clients. Like, we won't tell them how to diet or exercise or whatever, but we will be dealing with people that are dealing with that kind of stuff, right? So you are going to probably become one of the modifiable risk factors in somebody's life in a healthy way. Like they've decided to do regular massage along with their exercise routine, along with their diet routine. And you will be part of that healthy journey for them, which is beautiful, absolutely beautiful. That's the stuff within our control. Hey, by the way, the stuff within your control is actually much more important to health than the stuff that's not in your control. If you can reduce stress in somebody's life, it's huge. Miss Rader, please.
On that note, are we allowed or qualified to tell people, like, as far as diet and exercise and like weight and stuff like that, that if they are to lose weight, it might help with their lower back pain and stuff like that? Are we allowed to do that?
Yeah, I think the reason I'm hesitating a little bit here is I think you could tell them that from your experience, losing weight would help with their low back pain, because that's kind of a structural thing. Right. It's like, hey, you've got this weight on your tummy up here and it's pulling your back over. What I think you cannot do, what I know you can't do, is tell them how to lose that weight.
Okay.
So we're not licensed dietitians.
Okay.
Now, by the way, some massage therapists are, and if you're dual licensed, you can do that. But yeah, so you can't tell them how to lose weight, but you can. You're right. You can say, well, respectfully speaking, this extra weight that you're carrying around in front or behind or whatever is pulling your back off. And so with all due respect, losing a little bit of weight would really help this condition too, because that's on you all the time. Yes, you could say that. But then you couldn't be like, and I recommend keto. Cool.
Thank you.
By the way, though, one thing you can do, Miss Rader, if they ask, this is kind of, it's legit. If they ask you, be like, well, I'm not qualified to tell you. I can tell you what I do in my life. You can share personal information.
Right.
Yeah. So that's fine. So you can be like, oh, for me personally, I found that if I stretch every morning and eat a bowl of grapefruit and whatever, like you can share that stuff, but you're not prescribing it.
Okay.
But it's a great way to disseminate some information if you need to.
Nice.
Yeah. Okay. We will talk about different types of disease, all this kind of stuff. Some of the ones that are, of course, some of the terms here that are really important to us is under disorders congenital, which means that you were born with it. You've had it since birth. So congenital disorders, when it comes to massage, might be a structural problem with somebody, how their bones are actually formed. We're not going to fix that with massage. They're probably coming to us for relief from aches and pains from that congenital disorder. Because it's not correctable. Whereas if it's a lifestyle thing, it might be highly correctable. We start massaging them, they change the lifestyle a little bit, and it's all better. So congenital is born with. Autoimmune diseases. There are a lot of these. And here's the really interesting thing. Autoimmune diseases are when the body is working too well, it's hypervigilant, and it's attacking itself. Sounds kind of crazy, huh? This thing that was designed to help you gets hypervigilant and starts attacking itself. What I think is really interesting, and that you might want to explore a little bit emotionally, is when do you do this to yourself? So I understand the autoimmune disorders are when the body's defense mechanisms attack the body. Do you ever attack yourself emotionally? Do you ever take your mind, which is supposed to be there to support you and protect you, and call yourself stupid, fat, lazy? This is you attacking yourself too. So it's not really that crazy that your body sometimes does it too. It goes into overload. We see countries do this, by the way. Countries get so adamant about their defense of the country that they sometimes attack their own citizens and such. So this kind of thing where you can take defense too far is something we have a lot of evidence for in our personal lives and our communities at large. But autoimmune disease is where your immune system is doing too good a job and it's going after everything. It's very hard to deal with because one of the ways you stop autoimmune diseases is you cut back on the immune system. But that means you're susceptible to catching other things. So it's a very tricky situation to deal with. Cancer. You will work on lots and lots and lots and lots and lots of clients with cancer, severe and not severe. 25 years ago, this is not true anymore. 25 years ago, we used to be kind of cautioned from working on cancer patients because they said your massage might help the cancer to metastasize. And metastasizes when the cancer essentially breaks off in one area of your body, floats to another area and starts growing there, and now you've got 2 tumors. It has spread. And the worry was that massage would help it spread. I don't think there's anybody out there that thinks that anymore. Doctors normally prescribe massage for patients going through cancer treatments, assuming that they're well enough to receive the massage. If the chemo's too heavy and whatever, they can't. But it's definitely not thought of that massage will help metastasize the cancer, that you're breaking off bits of it and spreading it throughout the body. They kind of realize that, look, your heart's pumping the whole time, this stuff's spreading the whole time, so massage has nothing to do with that. And massage can be really nice for some people dealing with cancer, and it reduces stress. And we really believe that cancer and stress have a very close connection, which I'll explain in 1 second. Ms. Hendrickson.
Oh yeah, I just wanted to comment because my mom passed away of cancer last year, but I was here, well, so I lived in Washington at the time, but I came to visit, and I got to spend like the last 2 weeks with her, and I just gave her foot massages and leg massages and stuff, and it helped her so much, just like relief, because she had all this like swelling and stuff in her legs, and it was like, wow, this is really cool, and it feels good like to give it to help with that.
I really appreciate you sharing that story. That story that's your life. This is actually my favorite thing about massage. It's not, I mean, it's a great money-making occupation, and people are happy. I love that everybody's happy to see me. As a massage therapist, everybody's happy to see you. But my favorite thing about it is being able to massage loved ones.
Yeah,
and
it's like a great skill for life. Anyway.
Yeah, it gives you a way to intimately connect with people that are close to you in a beautiful way. And so yes, having massaged my own mother, my daughter, my girlfriend, my best friend, things like that, where you really can, like when you're, especially in a situation where words don't really, and you just want to be there.
It's a comfort, yeah.
Yeah, for everybody. It's just such a beautiful thing. I can't even comment enough. So thank you. Yeah. Ms. Carrillo.
Yeah, I just wanted to quickly throw in that I was having like some doubts about myself with massaging, because I thought, oh, I'm not really getting it, I'm not really understanding it and everything. And then this weekend I practiced. I just massaged my husband, and when I would ask him, I'm like, do you want the pressure more or less? And he did respond, but he was like more, but like out of it. He was falling asleep. He said if I was more comfortable, I would have fallen asleep because we don't have the table, so he was on the floor.
It's coming.
And it just it gave me such a boost of confidence, and it made me feel good that he felt good. And so, I thought I didn't understand much, but I did notice that I was doing things before. So it was just a very healing thing.
It is a very healing thing. Yeah, I love that. By the way, I realize this wasn't the whole point of your story, but I just want to reassure everybody out there. Every single class we have, the first month, they're like, I'm not getting it. I need to learn more. You got to tell me I'm not, I promise you this program, it just works. So it's set up, there's a method to our madness. It's set up with a whole psychology behind it. We are heading you down a path. And as long as you walk it with us, you will be quite good at massage at the end. Yeah. So you guys you're on day 5. You're doing great. Thank you for sharing. Okay. So metastasize was the important thing there. We won't, sorry. You will have some clients that have deficiency diseases, which is where they lack certain nutrients. Usually in our country, by the way, it's that they're getting too much of one type of nutrient or whatever, because there's plenty of food around here. But some people eat a very narrow range in their diet, and so lack of certain nutrients can be a problem with that. But again, we don't give dietary advice. Degenerative disease. This is disease that breaks down over time, overuse, or with aging. What does seem to happen as people get older, by the way, don't label your clients based on their age. And I don't mean because it's rude. I mean because I've honestly worked on 75-year-old clients that were in much better shape than 25-year-old clients of mine. And I really, really mean that. So I used to have a gentleman who would come to me every week. I loved him. And he was probably 75 years old. And I would beat the snot out of that guy. He liked deep tissue. And I went to town. He got 2 hours. He was great. He was in very good shape. And he got regular massage. And he was healthy. And I have had clients that were 25 years old. And I'm like, I hope this guy is going to make it out of here alive. They've got all sorts of health issues and everything. So I tend to judge clients by how they move and how their skin moves. If their skin seems kind of elastic and supple and thick, then I massage them like skin like that. If their skin seems thin especially, but brittle, not elastic, you have to be more careful with skin like that. I use more oil and things like that, and that is usually on an older person, but not always. So, if a person comes bounding into your room and they're like, hi, I'm 75 and I'm here to get a massage, I take that into account. You just came bounding into my room. You seem like you're pretty fit. And we've all seen this too. We've all had somebody come walking in, and sadly they might be 25 years old. And they come in, they're like, yeah, I'm here for my massage appointment. I'm like, oh my God. So there's nothing wrong with that. I don't have a judgment, but I'm like, this person might not be as good at health as the person that just came skipping into the thing. And I'm going to take that into account in my massage. So we do know that as people get older, though, that the effects of gravity over a long period of time, the usually effects of poor posture and lifestyle starts to catch up to them. And we see some degeneration, which is usually like between the vertebrae and their backs. They've got their discs that are there, their soft tissue start to kind of get flatter on them, and things like this. This is why older people kind of shrink. Every time I see my poor mother, she's shorter than she was last time, right? That is very common. We also see, by the way, tissue breakdown in people that overtrain all the time. So you will get, I used to have quite a few football players, that were really good, but after time, like all those overuse injuries, all those other injuries, and they're kind of dealing with stuff as a 40-year-old person that you kind of expect to see in an 80-year-old person. And that is an overuse degeneration too. So it's not always with age at all. And massage probably helps with all this stuff to some degree because it brings blood flow to those areas, and blood flow seems to help reduce degeneration. Mr. Singletary.
That's what I was going to ask you. I have friends of mine who've already asked me to help with massaging, and their bones are not as I guess strong. They're not brittle, but they're not strong enough. And they've already asked me if I would help them, and I said, well, yes and no. I'm not there yet. Could you give me a minute? Let me see what I can learn. How would you massage someone like that in a situation like that? They're telling you something wrong with their bones.
Yeah. So they're telling me they have some kind of osteoporosis sort of situation, which is their bones are not regenerating very well and their bones are brittle. These are people, when they fall down, they tend to break a hip instead of just get bruised. And that is something to take into account. I have found, by the way, that, there are certain modifications. I'm not going to get up on the top of the table and put my knees into their glutes and stand on them, right? Because that's an awful lot of pressure on their bone structure. And I would do that to anybody here in class. But I wouldn't do it to somebody who had osteoporosis. So I tend to do two things. One is just change my angle. I don't push down as much. I push more so I'm moving the tissue along.
Okay.
Yeah. And don't be afraid to push down, but I'm not trying to do compressions directly into their skeletal system, right?
Right.
That's number one.
Would
go ahead.
you do kneading?
Sure.
Okay.
Yeah. And don't be afraid if you can hug this person, you can massage them.
Okay.
All right. They can take some force, but I'm not going to do those heavy kind of like, you'll feel me get above you in lab one day where I push down on you and you'll feel your bones kind of go, those are healthy bones, and I know they're going to move, and that's fine. I probably wouldn't do that. I would not do that with somebody with osteoporosis. Okay. But I'm not afraid to touch them, believe it or not. Their bones are still pretty strong. It's that they can't fall and things like that. So that's one thing. The other thing is, if you're really, really worried, have them lay on their side. Because when you rub their back on their side, if you rub too hard, you're going to push them off the table, which is a whole other problem. Don't do that. But my point is, it's kind of hard to compress them at that point. So having them lay on their side and massage them that way kind of takes away those compression issues completely.
Okay.
And that kind of puts a governor on your moves to where even if you push really hard, you're just going to push them forward, So I like that too. It kind of puts a safety mechanism there. Really good question. Okay. And sir, I don't think there's anything wrong with you playing with that with your friends right now.
Okay.
That's my opinion. Yeah. Again, no heavy pushing, right? But besides that, I think you're going to be fine. I really do.
Okay. A lot of circular motions, stuff like that's okay. Just as long as I'm not going down.
Yeah, you're just trying not to
compression.
Yeah, and I'm just talking about don't do heavy compression. Don't put your body weight behind it. You can press on their skin. Okay. You're going to be fine.
Okay.
Yeah, if they were that brittle that just pressed them like that, they wouldn't make it out the door.
Okay.
That makes sense, yeah. And by the way, just to tie it all into our lecture, that's called a relative contraindication. So I told you guys about local contraindications, don't rub this area. And I told you about general or absolute contraindications, which means don't rub them at all. There's something in the middle called a relative contraindication. And relative means proceed with caution. So, osteoporosis does not stop you from getting a massage. But it's everywhere, so it's not a local contraindication and it's not a general contraindication. It's a relative contraindication. Proceed with caution. Be aware of what we're trying to do. Right? In my opinion, by the way, every massage should be a relative contraindication. We should be taking into account that person's special needs and adjusting the massage for their safety, so to speak. But this is a great example. Osteoporosis is a relative contraindication. Because you can still massage them, but you obviously don't massage them the same way you would with somebody who doesn't have osteoporosis. If that makes sense. Cool. We're not going to get into genetic diseases, but these are abnormalities in your genetic code. They can be passed from one generation to another, or can skip a generation and be passed. Like hemophilia, which is a problem when your blood doesn't clot. And believe it or not, my dad's a hemophiliac, which means I cannot be. He cannot pass it to me. He can pass it to my son. My son can be a hemophiliac. but I can't be because it actually skips a generation, but it is genetic. Ms. Hendrickson.
Is that the same thing as sickle cell anemia?
No, sickle cell anemia is different. So, quite different actually. So, hemophilia is a low platelet count, and that's not the red blood cells. That's these platelets that help you clot. And the danger is that we all bruise ourselves internally all the time, and we scab internally, and it fixes itself, right? We're self-sealing. It's kind of cool. Well, if you have hemophilia, you might not self-seal. So if you get in a car accident or have surgery or whatever, you don't seal up the holes in your body very well, and you could literally bleed out internally. Sickle cell anemia is different. It's where your red blood cells that are supposed to carry oxygen to all the tissue in your body. I mean, if anything alive in your body, by the way, has blood going to it, or it's not alive. Not for long. And I mean everything. Every last little bit of you has blood going to it. Anyway, sickle cell anemia is where the blood cells look like a they look like a moon. And it is a genetic disorder. And I think they don't pick up iron well then. And since they don't pick up iron, iron's what bonds to oxygen, so they don't carry oxygen very well. And it's a huge problem. And they are doing some really interesting genetic stuff with it now where they're actually trying to inject people with the proper gene to fix the problem to begin with. Like, forget about giving them a blood transfusion because that only lasts a little bit of time.
Yeah.
But can they actually change the coding so they don't have sickle cells anymore? They've got regular blood cells that look like jelly donuts and work properly. So yes.
Amazing.
Yes. Yeah. So that's sickle cell. And by the way, sickle cell does not exclusively, but it more heavily, unfortunately, affects black people. It's just that's what it's known for. Yeah. Okay. Metabolic disease. We're not really going to get into this, but it's when your metabolism does too much or too little of something, and I mean, like a really simple example is like an ulcer. Believe it or not, in some ways, is a metabolic disease where you are producing too much stomach acid, and it's actually eating away at your stomach. Stress related, but it is a metabolic disease where you are doing too much of something. In that case. It's 9:30. Let's take a break here. Okay. So there are multiple types of infectious disease. Bacterial, fungal, viruses, protozoa, and pathogenic animals. Animals that actually carry disease, very tiny ones usually. In all of these cases, I'm really not trying to make everything a ploy for hand washing, but in all these cases, hand washing, linen washing, super important to get rid of this type of stuff. Actually, all that stuff. Let's see, talk about some of these. I already told you congenital disorders are present at birth. Traumatic disorders are often when something violent has happened to the body. You would never work on a traumatic disorder. That's an open wound, a bone fracture, a sprain, or a strain right after it's occurred. So it's not that you would never work on a strain or a sprain, you would. But we don't like working on stuff the first 24, in fact, I would argue the first 48 hours after it's occurred. You will get people that come into you and they'll be like, I got in a car accident, I really need a massage. I'm like, oh, okay, when? Oh, about 30 minutes ago. No. We don't know if you're not going to have some big problem show up 24 hours, 48 hours later from the car accident that you're not even aware of yet. You still got adrenaline pumping through your body. If anything does come up, you could blame the massage for it. And you might be right, we'll never know. And so the general rule of thumb is if somebody's had a traumatic disorder, you don't work on it within 48 hours. A sprain or a strain, if the swelling's gone down after 48 hours, you could work on those. So I don't mean to make a blanket statement. Miss Everson, you put your hand up.
Oh, I was actually going to ask about whiplash, and you answered my question in your comments.
Good, yes. Absolutely, you can work on whiplash. It's super fantastic. You will get people with whiplash. It's a common thing for massage to treat after the 48 hours has gone by. Yeah. And maybe even longer if a doctor says to wait or whatever. But the point is, 48 hours works pretty good at keeping you out of the clear of at least they know what's really hurting by the time they got into you. They're not going to blame the massager and all that kind of stuff. Ms. Hendrickson.
Oh yeah, I just had a comment, agree with what you're saying about the adrenaline, because I was rear-ended one time, and I kind of felt it a little bit, like after in the next hour or so, but I didn't really feel it that much because of the adrenaline, and then 5 hours later, it really started to sink in, and you could feel it a lot more after that.
Sure, yeah. I mean, that's what adrenaline's designed to do. Right? It's designed to pump you up and get you out of a life-threatening situation until you're in the clear, and then to worry about all the other stuff afterwards, which could be serious, yeah. And even after the adrenaline's worn off, everybody, they could have mild internal bleeding. They could have all sorts of stuff wrong with them. They could have whiplash and they don't feel it yet. And so 2 days later is a long enough time for all that stuff to show up, swelling to go down, things like that, and to kind of know what you're dealing with. Then if they feel up to a massage, it's probably okay. Okay. So let's go over a couple of types of pathogens really quickly. These are just things that can carry disease, right? Give you disease, essentially. Viruses are kind of cool. We're dealing with one right now, the coronavirus, right? What's fascinating about viruses is they're not alive. They're essentially biologically speaking, like a little thumb drive or flash drive that carries a program that is completely useless, can't run, can't do anything until it gets plugged into your computer. And viruses are exactly the same way. They carry a code to make more of themselves, but they are not alive. They actually need one of your living cells to reproduce. And they truly aren't alive. They truly are a code that gets embedded and hijacks your cell and tells your cell to produce more of them. But the virus itself is not alive. And the significance of that is because they are not alive, they can stay viable on surfaces for a very long period of time. Because they don't need anything to stay alive, because they're not alive until they get inside you. It makes them kind of unique. Bacteria is a living organism. It's a very simple organism. But again, hand washing, washing your sheets with bleach and stuff like that kind of takes care of anything that we would really deal with. Fungi really are molds, yeasts, things like that. You will see some skin conditions that are caused by fungal infections. Athlete's foot is a very common fungal infection, and just like mushrooms, it is this dark, wet environment in the shoe that's giving a prime place for that fungus to grow. And by the way, yeast infections too are essentially microscopic mushrooms. Yeast are really microscopic mushrooms. They really, really are. Ms. Hendrickson.
Oh yeah, I was just gonna say about yeast, because isn't that something that naturally just already exists in the body, like candida as well, but it's like an overgrowth is when you have a problem?
Absolutely. So usually somebody's out of balance for some reason, right? Their chemistry's out of balance. And that allows this delicate chemistry in your body to change, and all of a sudden now you've got a fertile environment for this fungus to kick in because it's already there. That's true. Also, by the way, not to freak anybody out, but you probably all have life-threatening viruses in your body right now. And you probably all have cancer right now, just to warn you. This isn't to freak you out. You have this your whole life. It doesn't seem to be disease in a way that causes disease, as crazy as that sounds. It's when your immune system doesn't deal with it well anymore. So this is one of the reasons we know massage is so healing. When you are in a state of rest is when your body says, oh, I'm not doing anything else right now. I'm going to go fight off cancer, keep these viruses in check and all that kind of stuff. And people tend to get sick with stuff that's already there when they've run themselves down so much that their immune system isn't doing what it's supposed to do every day, which is keep this stuff at bay. It's fine to have, believe it or not, it's fine to have a little bit of precancerous stuff in your body. It's fine to have some fungus in your body. In fact, these are normal things. And you all probably have some viruses that are inactive in your body right now. But your immune system keeps them in check. And you're right. What we're really dealing with is when the immune system doesn't do that anymore and these things get out of control. But it's not that they're not there. Yeah. And immunity is actually much more important than anything for that reason. It's not exactly what you're exposed to. It's exactly how good your immune system is. And if it can recognize what you're exposed to and fight it off. Protozoa is a very simple form of animal life. And you're not going to come across stuff like this, actually, to be honest with you. Prions are kind of like viruses. They can replicate themselves, but they don't have their own DNA. You won't come across that probably either. Yes, Ms. Hendrickson.
Prions, do they exist in the brain? Because mad cow disease and the other one, it's about like ingesting brain tissue, right?
Yes.
Like that's more, it happens?
Yeah. I don't know. I mean, I know you're right about those. But I don't know if that's true of all prions, to be honest with you.
No, okay.
What you will deal with is pathogenic animals. Lice. So lice is super common, super infectious, and by the way, has nothing to do with your hygiene. In fact, lice is incredibly fond of clean hair. It doesn't like oily, dirty hair. So it makes you feel dirty if you get lice, but it is not a dirty condition. And it's highly contagious in the sense that they get everywhere. So if that ever happens to your studio where you work on somebody and you can see lice in their hair, you need to stop the massage right then. Don't shame them. They're going to be freaked out enough already. But they need to leave right away. You need to take those sheets and launder them in bleach and hot water and then clean the entire area around the table and everything. Because you don't want a lice infestation in your place. Yeah. They're pretty sturdy little suckers. But, by the way, not life-threatening at all. I'm not going to go into gory detail about chain of infection, but it's this model that they use to figure out how an infection travels through a place of work, a society, and how they get transferred from one person or another. And is there a reservoir, a source of the infection? The reservoir could be a person walking around spewing out viruses every time they breathe. It can also be an object that has that disease on it that's not getting wiped out and cleaned. That can be a thing that transfers from person to person as they touch it, like a doorknob. And then, of course, portal of entrance and portal of exit, or how does the pathogen get into your body? For most people, I mean, this is why we don't ever rub somebody that has a cut. We don't rub that area because that's a portal of entrance or exit. But you guys are a high pressure system, so normally when you're cut, stuff comes out, doesn't go in. Usually portals of entrance and exit tend to be the orifices of our body. So usually people, when they get sick with stuff, they get it on their hands and somehow it gets to their face, which is not hard to do because we touch our faces a lot. That's why you want to wash your hands a lot. So our mouths tend to be one of the favorite portals of entrance and exit for pathogens of all kinds. And the problem with your mouth is it just bypassed your skin. And your skin is your #1 barrier. And a very effective one. This is why massage therapists do not get sick any more than anybody else. Every study shows that. It's quite safe. And yet we're touching people all day long. And it's because skin is an incredible barrier. But once you bypass the skin, you've just bypassed your first line of defense. We're not going to get into any of that. So direct contact is when you are directly transferring something from you to your client to you. Indirect contact would be the client touching a doorknob, you touching the doorknob, and then you touching another client, right? There's something in between, something in between those two things. Believe it or not, in some ways we worry more about indirect contact because people fail to catch it. So we know to wash our hands after the client, but we have to remember to also wash the lotion bottle because that's indirect contact. We're going to get it through another source. And that stuff isn't quite as obvious. Vehicle transmission is kind of what I was talking about. A lotion bottle can be vehicle transmission. It's where the lotion bottle is acting as the transmitter for the disease. But we also get stuff like waterborne infections, things like that, where it's in the water and the water is the transmitter for the disease. Ms. Everson, please.
Do those bottle warmers prevent the disease from transferring? Could it potentially kill it with the heat, or does it just spread more?
No, I hate to say it might actually be worse. It might kind of keep it at a really nice temperature for that, for disease spreading. They do make your clients very happy, though. Clients really, like, I don't do a lot of fluff in my massage, but I have to admit from working at a spa, clients love warmed oil and warmed lotion. And bottle warmers are a great thing for that. They really like it. There's something about not having the shock of something cold going on your body, and warm oil and lotion's great. They also ruin the oil and lotion you have in that bottle if you don't use it fairly quickly. It's just like the lotion we talked about leaving in your car. But anyway, from a pampering point of view, you're right. I don't think they do anything when it comes to infection, if not make it worse. But from a pampering point of view, bottle warmers are amazing. Just you get small ones with small bottles, because if you don't use up that stuff, the bottle warmer, keeping that stuff hot all the time, tends to break down the oil very quickly. Yeah. But they're worth. If you guys are trying to create a spa-like environment in your house or place you work, I highly recommend bottle warmers. They're very cool. Yeah, we're moving right along here. Okay, really quickly, standard universal precautions. These are the precautions that you should use every time if you are running into something that could be a potential disease problem. So let me give you a really good example. Standard universal precautions would be used, by the way, you're going to use them every day when you do massage. One of your standard universal precautions is clean sheets and clean hands. And if there's no break in the skin or anything like that, that's it. That's about all you need to do. Wipe down face cradles and lotion bottles and wash your sheets and wash your hands, and you're done. But you also apply standard universal precautions when things are much more severe. Let's say a client had a cut or a wound open up on your table and now there's blood on your table. Blood is a great way to pass disease from one person to another. And so at that point, you would put on gloves, because you don't ever want to come in direct contact with that stuff, and you'd put on gloves and you'd bundle up all the sheets, and to be very honest with you, I just throw them away. Because sheets are cheap, and this is not going to happen very often. And that's what we used to do at the spa. If we had a problem like this, we'd just toss the sheets. Anyway, you bundle them all up, though, and then they have to be washed in a manner that you're sure is going to take care of any of the fluid on there and all that good nature. And again, really hot water with enough bleach will do that. But you would be taking more precautions to glove up. If you thought there was any chance of anything splattering or whatever, if this was a spill of blood on the ground, you'd have goggles on, a face mask, because what you're trying to do is avoid any particulates getting into open orifices in your mouth, your nose, your eyes, things like that. But in general, your guys' universal precautions are just going to be washing hands, washing sheets, washing lotion bottles. That's it. We already talked about this. Yes, Ms. Hendrickson, please.
If someone were to start bleeding, like if they have like a nosebleed or something like that, would you stop the massage? Like, would you wait till they're done? Like, what do you do then? Like, can you continue if they stop bleeding, but then you have to change the sheets in the middle, or what?
Okay, so this is the tricky part of our whole class. Because a lot of times what I would do is not what other massage therapists would do or whatever the book would do. I would not end the massage. I'm not very squeamish about stuff like this. And so the official answer is yes, you end the massage, you glove up, you remove all the stuff with blood, you wipe it all down, you get them whatever, and then if there's time, you go back and do the massage. But if they were okay, we're talking a little bit of blood, and the client really wants to continue, and they want to shove a tissue up their nose, and they want to continue, I'm not going to go running my hands through the blood and rub it. You know,
Right.
But I'm not really worried. I'm not coming in direct contact with it. I would keep going. I have told people we have to end a session before. I have told people I can't work on you before, but it's rare. I am always trying to find a way that I can say yes. And there are some rare occasions where I just have to be like, Ms. Hendrickson, I'm sorry, you know, your leg was cut off with a chainsaw 10 minutes ago, and we really should get you to the hospital. I really can't work on you right now. But in general, I mean, I'm like, okay, so the upper part of your body's on fire. What about reflexology for your lower body while we smother that with a towel? I don't want to turn you away for anything. Because people get upset, and there's usually always an answer. And so, no, I've actually had quite a few people bleed and pee on my sheets. I don't, by the way, guys, this isn't a regular occurrence, but when you do 15,000 massages, stuff happens. And, I mean, I deal with the sheets properly afterwards and things like that, but it's a little bit of fluid. People leak. You know. Yeah, so I'd keep going. I'd ask them, by the way, it's all up to the client. But if they're like, oh, this happens all the time, I'd be like, do you want some Kleenex? Yeah, can I lay on my back and can we keep going? Sure. Sure. Whatever you want. Yeah. The book would say, by the way, end it, but it's not very practical. Okay, hand washing, 20 seconds. By the way, I keep saying hand washing, but it's really like everything you use washing. So if you use your elbows, you're supposed to be washing, you know, partway up your arm. And by the way, think of it too as kind of a courtesy to your clients. Like it's kind of a respect thing for your clients. Hand sanitizer is not a substitute for soap. Ask anybody in the medical profession. Don't trust me, ask doctors. And ask them if they could choose between hand sanitizer and soap, what would they pick? And 99 out of 100 of them will say I would pick soap. Soap is actually much more effective than hand sanitizer, and if you had to pick one over the other, you'd pick soap. If you want to pick both, that's fine, but it's soap first, then hand sanitizer. There's a reason for this that a lot of people don't understand, is that you want to remove stuff instead of just sanitizing it. If you put a sanitizer on top of particulates that are on your hands, microscopic ones, it sometimes sanitizes the top of them, but not the stuff underneath them, and then later you rub that on somebody. This is all happening on a microscopic level. So soap is actually more important than hand sanitizer, always. You can use the hand sanitizer afterwards. And by the way, hand sanitizer, this is up to you, but there's a lot of controversy about it. And I don't know which way I fall on the fence on this, but for some people, the hand sanitizer is very hard on their skin. And if you are that person, you have my full permission to never use it. Just wash your hands. Because what happens is if you use too much hand sanitizer, your skin starts cracking on your hands. Well, that's a bigger issue. We don't want holes in your hand, right? So I'd rather you not use the hand sanitizer and keep using soap and have your hands be okay, because the number one barrier, again, is skin. So if the hand sanitizer is hurting your skin, it's not helping the situation. The other thing that's kind of cool that protects you guys is after you wash your hands, you're using lotion or oil or gel. And believe it or not, that creates a small barrier between your hand and the client that you will then later wash off. So it's very effective, actually. Wash your hands, put some oil on them, and you've got multiple barriers. You have the client's skin, your skin, and oil between, and you're going to get rid of the oil afterwards. That's why massage therapists really don't catch a lot of stuff. We're not going to get into PPE. Yep, I always use a cup of chlorine bleach when I'm washing sheets in hot water. I don't skip on it. Chlorine bleach is cheap. It's about $1.50 for a gallon. And I actually like my sheets to have a tiny bit of bleach smell to them. I think the clients appreciate them smelling like they're clean. That's just me. Okay. Let's talk about contraindications and endangerment sites. So, where do I want to start? Absolute contraindications. We've already said this should be review right now. Absolute contraindication means absolutely do not do the massage. It is the same thing as a general contraindication. I don't know why they have those two names for it, but absolute contraindications and general contraindications are the same thing. Absolutely don't do it, or in general don't work any of it. That's an absolute contraindication. That said, I've actually run into fairly small amounts of absolute contraindications because most people with absolute contraindications don't come to see you in the first place. You know, I've got this incredibly infectious disease, I'm running a high fever, so I came to get my massage. That doesn't usually happen. It does sometimes, but it doesn't usually. And so usually I'm not dealing with absolute contraindications. But that said, you are responsible for what happens in the room, even if the client said it was okay. So if I walk in with a high fever and Miss Hendrickson says, yeah, I'll work on you anyway, and then I get really, really sick, it's actually her fault. She was the massage therapist in the room. She made the choice. So the general rule of thumb is when somebody's running a fever, you don't massage them because that's a systemic problem and an absolute contraindication. That said, has Mr. Tapscott ever worked on somebody gently with a low-grade fever? Maybe doing reflexology on them because he didn't want to turn them away? Mr. Tapscott has done that. But Mr. Tapscott also understood that if anything happened, he was on the line for that. I felt very safe. I'm like, you're running 101 fever, but you feel fine. Let's do a little reflexology while you lay here and relax. That was just my solution to that. I'm also okay being in a room with somebody who's obviously got the flu or something, but the textbook answer and the thing you really should be really conscious of is if somebody's running a fever, you're not supposed to work on them. It's an absolute contraindication. I'm looking more at like, are they healthy enough to receive a massage? I'm sure you've all run a fever before where it was mild and you actually felt okay. You could even go to work if you really had to, you just didn't want to. And you've all had fevers where you're hallucinating and you thought you were going to die, and that's totally different. So I'm always trying to make that determination. Local contraindications, there's an area. You're going to run into all these all the time. I stub my toe, don't touch it. I have an ingrown toenail, don't touch that. I have a swelling of my right knee, don't touch that. I've got a big boil on my back, and I don't know what's wrong with it, don't touch that. Those are local contraindications. And they're all over the place. Yeah. Now, as a massage therapist, I don't ask clients, do you have local contraindications? They don't know what the term means. It's kind of, what I say is, are there any areas I should avoid? Oh yeah, I've got this pacemaker here that's sticking through, kind of avoid that. Okay, that's good advice. That's a local contraindication. Not going to change my massage at all, except that I'm not going to hit that area where the pacemaker is literally sticking out above. You can see it. Like, looks like a little roll of quarters there. Yeah. Cool. And then we get to endangerment sites. Endangerment sites are not sites you can't touch, but they're sites you should not go deep on. And I remember them is, in general, they are the folds of your body. So does my neck fold and bend? Yes. Should you go deep on my throat? Probably not. All right. Is it going to kill me if you push on it? No, but I don't like it. So I got to be careful with the folds of your body. I don't want you guys to be freaked out about necks because we're going to work necks all the time. But it's an endangerment site in that I'm going to not do everything I might do to an arm to a neck. Another fold of the body. It's called your axillary region, but it's your armpit. It's a fold of my body, and right in the dead center of my armpit, don't be afraid to touch it, but the veins and arteries and nerves are very near the surface there. So digging into your, go ahead and poke yourself in your armpit right now. You'll feel it does not feel pleasant. I am not talking about the things that make my armpit, which is my pectoralis major on one side and my latissimus dorsi on the other. You can go to town on those, But poking right into the armpit and going deep in there, you're very likely to cause artery damage and things like that. And it does not feel therapeutic. So I'm not afraid of armpits. I want the walls, right? The thing that made it an armpit. Because remember, when there's a valley, it's really because there's two mountains. I care about the mountains. But going right into the valley hard is not a good idea. You also have bends at your knees, your knee pits. In the back of your leg, same situation there. You just don't go hard right where the knee folds there because there's a lot of nerves and arteries and veins right there on the surface. And it's not that running your hand across them is going to hurt them. It's that you don't go digging into that area. Miss Carrillo, please.
I think I remember my sister-in-law when she was still in school for massage therapy, what, like, say this is like the back of the knee, my wrist right here. She said that she would do pressure and then light up at the bends of the knee and then go back to pressure.
That's exactly right.
Is that?
Yeah.
Okay.
Yeah, I actually rub all that stuff. Just don't dig. Don't dig in the knee pit, the arm pit, also the groin pit, where your legs kind of hook onto your body here, this little V here. I mean, you probably wouldn't be working that close to a client anyway, but this area, there's a lot of it. If you push it, it doesn't feel right. There's a lot of exposed stuff right at the surface there. So we worry about folds of your body and even your wrist. Like, I'm not afraid of working on people's wrists, but right here, you can even see some of the veins and stuff that are right there. I don't go digging into the center of your wrist. In fact, when I do, I get referred pain and stuff. Doesn't mean I'm afraid of wrists. I rub them all the time. You can squeeze them, but I don't dig into this little wrist pit. Just don't dig there. Mr. Ma, please.
Yes, sir. I had an experience before. I went for a massage. The therapist touched this area. Use the finger. Something is very sensitive for me.
Right
here. Yes, but she just kept me doing that and told me, I know it hurts, but it's really good after the massage. But that's the painful. I cannot accept it. So I just want to making sure from you, sir, is that correct? Can you just 100% trust your therapist when you feel no comfortable?
No. Thank you for asking that question. So one thing, by the way, everybody, what's kind of interesting is the insides of your arms and legs are more sensitive than the outside. That's just a little FYI. That's because the skin is thinner here. And think about it, the inside of my arm never hits anything. The outside of my arm, people come by, hey, Tap Scott, how you doing? Never happens on the inside. Insides of arms and legs are very sensitive. The skin's thin, it's very sensitive. But the other thing is, you don't ever tell a client, just trust me, like, it's going to be better later. I encourage them. I would say, Mr. Ma, does it feel like a therapeutic kind of pain? And he'd be like, oh, yeah, it feels like it's helping. Okay, then if it's okay with you, we'll continue a little bit further. But if he said no, or he said, no, it doesn't feel like a therapeutic kind of pain, I stop. There is no trust me, let's just do this. Does that make sense? Don't do that, because they can sue you later for one thing, and they'd be right. They'd be like, you told me to trust you, and now my arm's all bruised and stuff. I always want the client to make the decision. Like, hey, you're really tight in here. I hear it hurts. Does it feel therapeutic? It does. If it feels therapeutic and you're okay with it, I think we should keep going a little bit longer. But that's your call. Nope, don't want to. Totally cool. I got it. Make sure the client decides. Don't tell them just to trust you. I think you'll get yourself in trouble. I think you'll get an angry client coming back later. So I'm trying to give you a better example, Mr. Ma, but I think that massage therapist should have said, well, I know it's uncomfortable now, but I think it'll be better if we keep doing it. Are you okay with that? She should have said, are you okay with that? And she should respect whatever you say. Once they tell you no, they're not okay with it, don't argue with them. That's it. We drop the subject. Okay, we're moving on. Yeah. And I do this too in my deep tissue, because sometimes I'm going really deep on somebody, and I think we're at the limit. And they go, hey, could you go deeper there? And I'm like, okay, well, this person's healthy enough for me to go deeper. I'm not worried about killing them. But I tell them, hey, I'm okay going deeper in this area, but you're probably going to be really sore tomorrow. Are you okay with that? And sometimes they're like, yep, don't care at all. Go for it. Other times they're like, oh, I don't want to be sore. Okay, well, then we should do it. But I want them to make a decision so when they wake up the next morning and they're like, my God, my back hurts. Yeah, I told you it was going to be sore. Like, we tore it up, on there. I want them to make a choice. Yes, Mr. Ma.
Yes, I just want to say there's a lot of massage therapists. I don't know where they get confident, and they always want to show some techniques, and it doesn't matter. They never care if you feel hurt or painful. You just this is good for you, and at the clients we are not professional like them, or they are not professional either, but we are doing massage. So yeah, I just want to see this the problem,
Yeah. Massage therapists sometimes develop a God complex, just like doctors sometimes do. And they tend to get a little preachy sometimes. And they tend to be like, nope, this is just what's good for you. I've been doing this for 8 years. I know what I'm talking about. Well, you don't know what you're talking about because the rule is customer service every time. So don't forget, guys, we are in a therapeutic healing profession. Totally true. You're going to make people better, all that kind of stuff. But you have to sell your massage, and the number one rule is customer service. And yes, I don't ever want a customer to wake up the next day and be like, that really hurts, and I trusted you, and now I'm angry. Yeah. So you're right. They don't know, and all I can do is make recommendations, and I still have to stand by my recommendations. If I tell you let's keep working on an area, even if you agree, I still better be pretty sure what I'm doing. Because if you're really sore the next day and I told you it was all going to be okay, even though you agreed, you're not going to be happy. So yeah, just remember, guys, like, you guys are going to become amazing massage therapists, but that doesn't mean we're going to know everything. We're not even going to be close. Yeah. And you're right, I've seen that too, Mr. Mom. Yeah. I've also had therapists argue with me why they're the greatest therapist in the world, and I always just ask them, why don't you have any clients then? Because that's the measure of a great therapist. I know some very basic, simple therapists that have just great people skills. They do a nice massage and they've got loads of clients. That's really the key. All right, so avoid the folds of the body. Avoid deep. Don't avoid them. I don't want anybody to be scared here when they go massage people's knees or anything. Don't be scared at all. But don't stick your elbow in their armpit, their knee pit, their groin, or their throat, which I think would be kind of obvious. And if you do it, go really slow so they can say, stop doing that. Those honestly are the big endangerment sites on your body. Yes, Miss Carrillo, please.
So basically anything that has like a flex, like right here, this bends behind the knee, this bends behind the neck, that bends, and then like in between, like you said, the V area, that bends. So basically anything that bends.
Yep, anything that bends. And I'm not saying don't rub anything that bends, don't dig anything that bends. You guys want to go over, you can go over this with a flat hand for 5 days straight. Like, it's going to be fine. Just don't go digging in there. Yeah, you got the right idea. Cool. Okay, so here's Tapscott's rules of safety, because I like to take, I mean, how much of this are we going to remember? And I'm giving you my real world experience. So this is just my gentle advice to you, and I do mean gentle. I'll tell you, like, when I asked about, like, tell the client, when I said ask the client, do you want more or less pressure? As far as I'm concerned, that should be a rule in stone. These are not rules in stone. These are guidelines I use when I'm looking at a client. One thing I believe is something I'd call testing the corner of the carpet. Anybody ever see a carpet cleaning commercial on TV? And when you read the bottle of a cleaning product and they say, try this in the corner of the room first, this product. Why do they do that? Yes, Miss Carrillo.
To see what kind of reaction it gets from either a person or the material?
Yes. So the carpet cleaning stuff, they're worried it might lift the color of your carpet, and they don't want to pay to replace the carpet from your entire room as a company. So they don't want you to be like, I tried it in the middle of the floor and now I've got a big white spot in the middle of the floor. You can do the same thing with people. So there's a lot of these situations that aren't a yes, massage them, or no, massage them. It's a maybe, massage them. And so when you come in, let's say you sprained your ankle and the swelling is down now, and I'm going to massage it, but am I going to spend an entire hour working on your ankle the first time? No. because I might re-irritate it and it might swell up like a balloon the next day. Instead, I would massage it with medium to light pressure for 5 minutes or something, and then do the rest of the massage. And I'd say, hey, Miss Carrillo, when I see you next, I'll ask you about how your ankle is doing. And if you see me the next time and you say it was the same after I worked on it or better, then I will increase what I did. But I don't do it the first day. I don't go to town on you because I don't know how you're going to respond. And nobody does. Greatest doctor in the world doesn't know for sure. And so if you respond well, I increase the duration and the intensity. That's fine. But test the carpet. So when in doubt, you don't have to say no, but when in doubt, do a whole lot less. Right? Oh, you've got whiplash. It's been a couple days after the accident. Great. Let's work on your back and your legs. Let's do some neck work, but I'm not going to spend the whole hour doing deep neck work until we see how you respond. The next time I see you, go, oh, I think that really helped. Okay, now we'll do more. Test the water. Don't be afraid to test the water. Your book and life wants to make everything black and white, and it's not. Everything's gray. Everything's gray. Okay, so because it's gray and the carpet's gray, test it in the corner of the room. That's what I meant by test the carpet. Use common sense. And hedge your bet. Like if you're not sure, I'm often not sure when I work on somebody. I just actually worked on a coworker Thursday. She was in a car accident. Her back's been bothering her. And I had her come in here and I was working on her back and I worked on her for about 10 minutes. And I said, okay, Miss Swan, she runs the aesthetics program. I said, let's see how you're doing Monday. She's like, oh, because I wanted to make sure she doesn't come in Monday and go, oh my gosh, after you worked on me for 10 minutes, it was so much worse, because that does happen. But it would have only been 10 minutes. It wouldn't have been that bad. Instead, today she was like, I feel great, which means the next time I work on her, it could be a half hour. It's fine. Like I was testing the carpet. Miss Green, please.
So, would you say that it would be probably a good idea if for someone that's starting their own business to do like consultations before?
Sure.
So that you already kind of know, because sometimes I feel like when people go to get massages, they just want a massage. They don't really know what kind of massage they want, and there's different types. So I feel like in order to best like give someone, you know, your thoughts on what would be best for them, it would be best to probably previously know before they even come in, you know, what their issues are or what is bothering them, I guess, right?
Yeah. I agree. You need to do some type of consultation with every client. Now that consultation might be, again, I'm very old school. And so my consultation is, hi, what are we working on today? Because I want to know, are we working just a full body? Are we working on something specific? I always ask, are there any major medical issues I should know about? I always say major medical because if I don't say that, people go, well, when I was 4, I bent this pinky back, and I'm like, oh my gosh, I don't have time for this. I love you, but I need to know major stuff.
Yeah.
Right? And it's only major stuff that matters for me. Other therapists, by the way, you know, have long things for clients to fill out and stuff like that. Only thing I would say is, don't ask clients questions that you're not going to use.
Okay. Thank you.
So, like, a lot of people are like, do you have high blood pressure? That's on almost every massage therapist intake I've ever seen. And I ask massage therapists, how does that change the massage when you find out they have high blood pressure? It doesn't. It's not an issue for massage. People's blood pressure drops while they get a massage. If you're a personal trainer, you care that they have high blood pressure. But I don't care as a massage therapist, so why am I asking? And I don't want to ask for information I don't need or I'm not going to use, because later they can come back and be like, but I told you this, and whatever. So I ask for stuff that really matters for the massage, and there's a lot of stuff that does not matter for massage, and people just ask out of habit, you know? Yes, Miss Everson.
Are there any medications that we should be aware of, such as like blood thinners, that we should know about before doing a massage?
Yeah, you kind of nailed it, actually. There's 2. There are 2 things that you should be concerned about as a massage therapist. Blood thinners are one, and the problem with blood thinners is they make clients bruise very easily, and that's why we care about blood thinners. So when somebody tells me they're on blood thinners, I'm aware that this person might bruise more easily, and I'm going to back off my massage. Doesn't mean I'm not going to massage them, but I'm not going to go psycho on them. That's something I'm going to test the carpet pressure-wise with them. So that's one thing. Blood thinners are really important. The second thing that's really important to take into account is painkillers. And that's pretty common, right? Lots of people get prescribed painkillers for something. And I don't care that they're on painkillers, but the problem is that one of the things that makes massage really safe is that when the client says, ow, you stop. And bodies give really good feedback. So in general, if something feels good during the massage, it's okay to do. Well, if they're on a lot of painkillers, they don't know how deep you're going. And they're like, no, you can go deeper. But they don't actually know how deep you're going because they're on painkillers. So again, I'm not judging that. I'm still going to give them a massage, but I am much more careful when you're on blood thinners or painkillers because the feedback systems aren't there for me. The safety measure is the client's reaction to my pressure, and they're not able to give me accurate feedback. They've turned down their meter a great deal. So those are the only two I worry about: painkillers and blood thinners. Yes, Miss Green.
So I was wondering, since we were talking about like things that we don't do, so my mom, for example, she's gone to get massages before, and she's had like a plaque buildup in her carotid artery. So like I guess her doctor told her to let the massage therapist know not to like go like deep into the neck at all. But what would be like your thoughts on that? Just like, do you think that she could have her neck massaged just very lightly, or you wouldn't touch it at all?
I wouldn't touch it at all. And like I said, I'm pretty old school. Normally I'm like, rub it. I wouldn't touch it all for a couple reasons. Number one, if your mom comes in and says, and tells me that, and tells me the doctor said not to touch it, that's it. Even if I think the doctor, I don't think this, but even if I thought the doctor was an idiot, that's it. Because can you imagine in court if anything happened? Like, they'd be like, I came in and told you that my doctor told me not to do this, right?
Yeah.
So, like, it's done. There's no discussion at that point. But the other thing is, and I do this with life, by the way, I think this is good life advice. I don't worry about the consequence itself. I worry about what the consequence will cause.
Mm-hmm.
So if you're on blood thinners and the consequence is you're going to bruise, bruises go away. People live. If the consequence is the plaque in your carotid artery goes up to your brain and kills you, that's too serious a consequence for me. I care. I don't mean this to sound insensitive. I care if I bruise you, but okay. We're all going to get through that situation in 3 days. I don't want to kill anybody. And what you're talking about is actually life-threatening. So you're right. I'd just be like, oh my God, if I'm wrong about this one, maybe it's 1 in 1,000 chance, but the 1,000th chance is a horrible consequence.
Okay. Yeah. And even if they didn't even say anything about a doctor saying not to do it, I think that would probably be something you really need to just have some knowledge on.
Yeah. I'll give you an example. I have people come in sometimes, they're like, I have a herniated disc in my back. Be really careful back there, whatever. I'm very careful because I don't want them to be upset, but there's no way I'm going to make the herniated disc worse, and there's no way it's going to kill them. None.
So if they had that as their issue, would you use effleurage?
Yes.
Okay.
Yeah, and I actually try to work into the area slowly, like, hey, is this okay? I want to get to the area. But I know that if I'm wrong, nothing's going to happen. I might upset the client, and I do care about that, but my point is nobody's going to die. So, but when it's a situation where I'm like, oh my gosh, you could die from what I'm doing, I'm not going to risk it. Yeah.
Okay, thank you.
Yeah, so think about how severe something would be if you were wrong. If it's like, then don't worry about it. Go ahead and take the risk, but that's too risky. Mr. Ma, please.
Yes, sir. I heard something from somebody that the massage has two kinds of massage. One is like close on, another is close off. Like close on massage would be like Thai traditional stretching style like that, and foot massage. And close off would be like some Swedish or deep tissue.
Yeah.
You have to put oil on the back.
Yeah.
So then somebody said if you're doing Thai stretching massage, it's close on or foot massage. So the license is not necessary if you're doing that. I'm not sure if this is real.
So wait, what's not necessary if you're doing what?
If you're doing some massage with clothes on, so the license is not.
Oh, the license isn't necessary if their clothes are on. Yeah, that's not true in Arizona.
Oh, okay.
So, if you are getting paid, or somebody is charging them, if you're getting money, and you are touching somebody, you pretty much need a license of some kind. So, and the state board's actually really strict on this because a lot of people are like, well, they were clothed and we were just stretching them. Okay, still need a chiropractic license, massage license, or physical therapy assistant license or something. So no, they're trying to find a loop in the law, and there are loopholes in the law, but no. If you're massaging somebody through their clothing, and you are charging them for it, you have to have a license. They're going to bust you on that one, yes.
So, like, if you're doing Thai stretching massage, you have to get some license. Is cover the Thai stuff, right?
Yeah, you should get a license. You really are. Yeah, I'm not saying people don't get away with it, but if the state board found out about it, they'd say no way, no way. Yeah. So even though they're fully clothed, even though you're like, I'm just stretching them, yeah, you might be able to get away with it with a personal training license, because you could say I'm just stretching them and not use the word massage. But you need a license. You'd really be pushing it. Yeah, I'd be worried.
Sorry. But if you have license from another state, so it doesn't work at all here, right?
No, that's the other thing. It doesn't work at all. I mean, some people have licenses from other countries. They just don't work here. Yeah. Hold on, everybody, 1 second. Yes, sir. You're just muted.
A gentleman from marketing here to see you.
Oh, yeah. He can come right in here. Yeah, sorry.
No problem.
Sorry, they were asking me a question outside of here. Anyway, yeah. I wish I could tell you otherwise, sir, but from knowing what I know about the Arizona Massage Board and the laws and everything, because I've talked to them about some of these loopholes and stuff like that, if they chose to, they could easily prosecute that, and they probably would. Yeah, you want a license, because they know people are tricky. People are like, well, I'm not charging, I'm just getting tips, or I'm not massaging because they're clothed. Arizona State Board goes, baloney. We don't care. You were touching somebody for money, and you don't have a license. That's the whole point. Yeah. Okay. Did somebody else have their hand raised? Anybody? Did I miss them? No. Mr. Richards, please.
So if you did touch someone without a license, would you be banned from massage for life, or could you wait a while then take the test? How do they?
And by the way, let me say, touching them's fine. You can massage anybody you want right now. It's charging them. It's if they give you a tip, if you've received some type of remuneration for it, a chicken, cash, whatever. My understanding is that no, you'll never get a massage license in Arizona after that. Yeah.
It's like a criminal conviction against your name, isn't it?
Yes. I mean, yes. I don't know the exact charge, but it's like a criminal conviction. Yeah, it is a criminal conviction. Yeah. Ms. Hendrickson, please.
What if you were exchanging services? Would that still count as getting paid? You mow my lawn and I'll give you a massage. Would that still be?
Technically, yes. I hate to talk like this because it sounds very unprofessional, but really the question is, can it be proven, right?
Right.
What you don't want to do is put an ad out there saying,
right, I'm
trading massage for lawn services. Because then the board says, look, we've got it in writing right here.
Right. But if it was like your neighbor or something.
Right. Yeah. Should you rub your mom's back and she gives you $20 to go get a coffee because she loves you? Is that of course.
Right. Exactly.
Right. The board is looking for things that can prove and it's not out to get you anyway, but it's looking for unscrupulous behavior. And you're absolutely right. You're talking about something very, very limited. And technically, yes, but the thing is, don't advertise, don't do this, don't accept tips during clinic where somebody might not be whatever. If your friend buys you coffee because you massage them, yes, you're not supposed to do that, but those are personal relationships. I think you're probably okay there. You really are.
Gray areas.
And they can't be proved.
Exactly.
But let me give you this example just so we all know really quickly. Let's say you work on me, Miss Hendrickson, and I'm a jerk. And I write a check for you because I'm like, oh, you're great. I know you're a student. You can't take this, but just take it. Trust me. Here's a check. Here's $50. I'm loaded. Don't worry about it. So you take it. Now the next time you massage on me, I hit on you. And you're like, oh, you can't do that. And I'm like, oh, kind of like you can't get paid to do massage.
Oh, yeah.
And I've got proof.
Blackmail situation
Yes. And you took my check and cashed it. I've got proof. Or my credit card or whatever. So
leverage.
Don't, if these are family members, go for it. But that, I just want to kind of point out to you guys what can happen if you get some jerk that kind of took advantage of that situation. Yeah. But you're not talking about it. Your friend, your neighbor mowing the lawn, you're fine. Yes. Yes. Ms. Green, please.
So I was just wondering, with what you were just saying about working on people, but not for money. So if I wanted to work on someone, like say like my friends or something, would it be a smart idea to create like a legal document for them to sign that basically lets them know that I'm not licensed? So you're basically doing this on your own terms, basically. So if something happens, I'm not reliable.
Yeah, are you charging your friends?
No, but if they choose to give me a tip, that would be on them.
Well, yeah, but if you accept it, that's on you.
Okay.
So, I'm not saying it never happens. I'm sure it happens all the time. What I was going to say is if people aren't paying, you don't probably need a legal document because you're just rubbing your friends back. And you're like, I'm in school, and if you want to let me practice on you, you can. You know, I'm worried the legal document makes it even more obvious that you're accepting remuneration or something.
Yeah, because I mean, like I've worked on one of my friends before, and she's given me like $10 as like a tip or whatever, just because for me doing it for her or whatever. She's like, "Well, thank you, it was great." Like, you know what I mean? So I'm just gonna give you $10. Like you don't have to do that, but I did accept it though, so I didn't know if like that's okay.
Well, I hear in this hypothetical situation that you hypothetically worked on somebody that hypothetically gave you $10 that you hypothetically accepted. That would hypothetically not be okay. But I know that you're just giving me scenarios and not something that actually happened.
Yeah.
All right, everybody. So here, last thing. We got 1 minute left. I've released your homework. You have 2 homework assignments, just 2. You'll see them. They're obvious. One is to prepare you for tomorrow's chapter, but really important. It's the walk around the block rule. This is a Tapscott rule. Essentially, if somebody comes to me and I feel like they can walk around a block comfortably, they can probably get a massage. I realize somebody in a wheelchair can't walk and they might still be able to get a massage, but it's just my general thumb. Is this person systematically healthy enough to kind of walk around the block? Then they can get a massage of some kind, right? If they come in and they look like they're dying from getting into the car to your room, that's a problem. That needs further analysis. But I just always ask myself, this person seemed like they might huff and puff, but they can make it around the block. Okay. They're not going to die on my table. We can massage them. Just a common sense thing to throw out there. It's 11 o'clock. It is Monday. We are on our second week together. I'm delighted to see you all here. Thank you, thank you, thank you. We will see you in your respective labs today, and I will see you tomorrow morning. And thank you all.
Bye.
Bye, everybody. Happy Monday.
Bye.